Dr. Taylor, Dr. Kinsler, how are you?
Very well,
Good, thank you.
Great. Thank you so much for participating and supporting the 10th China Rare Disease Summit. My name is Yiping Shen. I am a medical geneticist. I work at the Boston Children's Hospital. I am in China on site, and I'm very, very happy to have listened to Dr. Taylor's talk and look forward to Dr. Kinsler's talk. We will have this Taylor discussion. We will have this session first. I have an audience here. Hopefully they will have some questions for you. When I listened to Dr. Taylor's talk, since I know the Great Almond Street Hospital for Children, we share many characteristics between Boston Children's Hospital and GOSH. I actually admire the things that Dr. Taylor has introduced in innovation, in new technology for diagnostics and treatment. Since you are the Chief Officer of Innovation, I do have a question for you, Dr. Taylor. And although you have outlined many interesting, very innovative approaches for implementing new things into medical practice. But I noticed in UK there is a huge project using genomics. Genomics UK is a great project. What have this project directly impact the children's care in your hospital? If you could introduce, because the whole genome sequencing is the choice of your project right at the front. Not like in many other countries, people using exome sequencing or other sequencing technology, but you have chosen whole genome sequencing from very beginning. This is a very bold and very remarkable choice for me. I really admire this choice, and you must have debated over the decision making why choose the whole genome sequencing as your approach for implementing genomic medicine. That simply is my question. I want to hear whether your inside story about this Genomic UK project. Please go ahead.
Okay, so I apologise, I have a little bit of an echo. So I think Veronica may be able to give specific details about specific projects. What I can give you is a sort of overview. So the UK went for a project called the 100,000 Genome. Yep. Certainly within that, actually, particularly for paediatric disease, Great Ormond Street's by far the biggest contributor to that. From a UK perspective, I think what we're really dealing with now, so we've got all of that data in, is now how, because the most important thing is how you link that data into the clinical world. So Veronica may have very specific examples in her own area and her own work that link those together, but for the UK at the moment, that's the next major step. So certainly for hospitals like ourselves, that's really about trying to create these trusted research environments where we can link the imaging, the clinical data, the genomics data all together. So that bit of work is now going on. As I'm not a geneticist by background, so why it was whole genome sequencing, I can't quite answer, but Veronica may be able to help there.
Okay.
But that's where we're at this stage. So it was a kind of a visionary piece of project work, I think at the time, and we'll begin to see the fruition of that as we bring all of those data sets together. So that's going to be hugely important. Veronica, I don't know if you've got anything to add to that.
Yes, I think that's all correct, actually, what you said, Andrew. As far as I understand, the reason that they went for whole genome sequencing is because there are certain advantages. So in particular, because with whole genome sequencing, you get much longer reads, it is easier to read across difficult areas of the genome. So when you're, for example, trying to look for structural abnormalities or copy number changes, you are more likely to be able to read that from whole genome than whole exome sequencing. It's also actually not as much more expensive as it used to be to go from exome to whole genome. And so I think it was also a strategic decision that it's better to cover everything, have that data there all in one go, rather than do a sort of part of a project. And then in 10 years' time, we find we want to know actually the whole genome sequence. So I think the decisions were for those reasons.
Yes, I totally agree, actually. I think it's a very right decision. You're already seeing the output that brings things that cannot be brought about by using other type of approach. This is really a great choice. In order to implement this genomic medicine, all the healthcare providers need to be educated regarding their role in this new practice of medicine by understanding the importance of genetics and genomics. I know education and training is a significant part of this whole plan. How Dr. Ter has mentioned part of education, but how every different type of healthcare providers are getting involved in training, because many of them have graduated years ago from school, but now they have to get retraining on site or specific program nationwide, or you're doing this on site on your own hospital. I would like to learn more about the training efforts going on.
Okay, so I think that's a bit of a combination of all the things that you've said. I certainly think from our own perspective as a dedicated paediatric hospital, there's quite a bit of education that we need to do that's not specific to us, but as you said at the beginning, the bigger children's hospitals have some of these issues, so there's quite a lot that or a huge amount that we're now beginning to provide. I think the other real change, lots of reverb there. So the other real change that we've seen is clearly over the last 18 months with the changes in moving to a more virtual environment, as we're doing now, has been actually that we're providing much more teaching online. And one of the areas or certainly I'm very keen on looking at, particularly from a cardiac teaching, which is my background, is how we use virtual reality in that. So we've been piloting some work where we can teach our students at home using virtual reality, which is very important for some things like teaching complex cardiac anatomy and congenital heart disease. So actually, the students now, with a teacher guiding them through virtual reality, are able to maneuver through these very complicated hearts with somebody really guiding them and teaching them. And the next step for us is to use those techniques, and we've used them in a few places now. So how you give surgeons that sort of view of the world. So using virtual reality to plan cardiac surgery, but also one of the areas, and it was very recently in the press and certainly on the television in the United Kingdom, how you separate conjoined twins. So there's a lovely video of one of our surgeons looking at two twins who are joined at the head. Actually, for the first time ever, he's able to see in huge detail exactly how the arteries and the veins are mixing between those two children, so that when he goes into theatre, before he goes into theatre, he can really plan that operation and separate those vessels to ensure that both children have a good outcome. So I think that from an education perspective, those are the sorts of ways that we see things developing. And the good thing about virtual worlds is that you can then teach many, many people and not just the people locally. So it becomes much more easy to share our expertise.
Thank you. Virtual technology plays a huge role. Dr. Kinsler, your input. You're a geneticist yourself. How are your colleagues, such as counselors, are being updated on genomic new informations?
Sorry, you went a bit quiet there. Was it a question for me?
Oh, okay. Yeah, Dr. Kinsler, you yourself is a geneticist. I wonder how is the new genomic technology and the new knowledge about the genomic medicine being implemented in your practice?
So it's a really good question, because clinical genetics used to be a very separate specialty, and we have genetics in every single specialty of medicine, because nowadays it is important, it informs clinical management for us all to be able to do genetic tests and also to interpret them. So there has been a lot of training. Yeah. So I was lucky that I started doing molecular genetics about 15 years ago. So I sort of retrained in that area. But since then, actually, it's become much more part of the core curriculum for training of medics coming through, so medical students and early career medics. So I think it is now becoming part of general training in all specialties, not just in clinical genetics.
That's right.
And in terms of the counselling, you're correct. That has also been an area in which there's been a lot of work done, because obviously we are finding lots of changes on these genetic tests, which are not always straightforward to interpret. Sometimes it's very clear that the gene you find is the disease-causing gene, but sometimes you find something and you're not quite sure. And in that context, it's very important that the family are counselled very cleverly and correctly and with skill. So actually, you're correct to highlight that. That is an area that there's been a lot of work on, and there was funding in the 100,000 Genomes Project specifically for that, which has been really helpful.
Great. Thank you. I wonder if we have questions from audience. If you do have, please raise your hand. I do have, yes, please. Please hold a second.
Okay, thank you. As a family member of a patient with rare disease in China, I have a question for Dr. Shen and Dr. Taylor, and also Dr. Veronica Kinsler. I need to know how we can get an effective second opinion from Boston Children's Hospital or Gosh. How can we find the right doctor? And how can we provide the information the doctor needs? And what's the channel of getting the second opinion? Thank you.
Dr. Taylor, Dr. Kinsler, did you hear the question from the... Okay. She's asking, how can we get second opinion from doctors like you in England and people in Boston? I think that there is a lot of needs, especially for rare disease family members. They do want to learn more and to consult with different experts around the world.
So certainly from that perspective as a hospital, so we have a department which is called the International and Private Patients Department. That is the portal, the sort of way in from international patients for those sorts of opinions. So there's a website related to that, and certainly we know and this is probably pre-pandemic, and clearly things have slowed down a little bit during the pandemic, but there's clearly a need. We have been working certainly with lots of partners in China to see how we can facilitate that. But I think that, and I showed one of my slides when I presented, certainly we've moved, or what we've tried to do is to get at least 40% of our own patients seeing virtually. There are some pros and cons to that, but that's kind of where we're aiming at. And that's been very important for patients, but very important for this, providing that sort of skill set, because you have to interact differently with people in the virtual environment when you're delivering a virtual clinic. But certainly to begin to have those initial conversations, that sort of technology is now up and working. So certainly through our international, so our IPP department, you can make those contacts, or individuals can make those contacts, hospitals can make those contacts.
Great. I think the world is connected, just like we are doing right now. We need to create a channel to connect patients and doctors around the world. As I know, Boston Children's has a special department for international patients. We actually put a lot of effort on seeing more international patients as possible. There's Chinese-speaking doctors on site, so it is possible. But pandemic have actually indeed, on one side, have reduced the volume, but on the other hand, we can actually use virtual connection to communicate. There is some work to do to create this type of channel. We have Li Jing here, so I think this is something that we can think about, how to help. Thank you. Any other question from audience, please? Wonderful. Go ahead. Oh. Here's another Mac. You can come up on stage.
Hello.
Okay.
Hi. I have a question for Professor Taylor. The question is about gathering some facts. So we want to see if we can collaborate in some way. So my question is, does the Gosh has some preclinical research capability for pharmaceutical research per se? For example, animal models and enzyme models and so on and so forth to establish some early projects.
So Gosh and Veronica, I'm sure, can also talk about this. So from the perspective of Gosh, we have a partner who is called the Institute of Child Health. So the Great Ormond Street, UCL actually, so part of UCL University, Great Ormond Street Institute of Child Health, just next door to the hospital. So there's lots of basic research that goes on in there, and there will be models that will undoubtedly, or there will be many disease models that have the potential for therapeutic intervention. So we have that. From a drug discovery perspective, that's not something we've done. So we need to find partners to work with to make that happen as we move forward. What we are strong of, and you'll have seen in my talk, is the sort of, I think of it as almost drug discovery, is the gene and cell therapy. So lots of basic science goes on at Great Ormond Street through the Institute of Child Health. So again, it's about, as ever, it's about linking what the problem might be with the model that we might have. So that's how we would take that forward. Clearly, Veronica's got huge experience in models related to dermatology and so on and so forth. I don't know if you want to comment, Veronica.
Yes, I mean, that's all correct. I think those two questions are actually similar. These are about access, and I would totally agree that we are here. We provide a clinical service. We also have a fantastic research set up for rare disease particularly, but also across the board in pediatrics. And we are open to approaches from either for that clinical expertise or for plumbing into the Institute of Child Health research expertise. So I think these questions are good, and I think actually the approaches can come from either side. So if people are interested in approaching us, then the way to do it is via the international, probably initially, and collaborations can perhaps be set up.
Well, thank you, Dr. Taylor and Dr. Kingsler. Any other questions? If not, I think we would end the discussion session, and we appreciate your time and your participation and support to our summit. We look forward to more collaboration and interaction in any other format. Hopefully you can join us on site next year for this meeting. Thank you.
Thank you. Thank you so much.
Thank you.
And also thank you for your collaboration. I made a point of it. So we had a great bit of information from Wuhan Children's Hospital at the start of the pandemic, which was invaluable for Great Ormond Street. It really was very, very useful. I mentioned it in my talk, but that collaboration was super useful for us as a hospital. Sorry to interrupt, Veronica.
Indeed, that's great. We are in the same word.
Bye-bye.
Bye.
Thank you.
Thank
Bye-bye.
you. Bye-bye.